Hello, JMIR followers. Today, I'm delighted to be interviewing Dr. Wasim Ahmed about his recent JMIR publication, COVID-19 and the 5G Conspiracy Theory, Social Network Analysis of Twitter Data. Dr. Ahmed is a lecturer in digital business at the Newcastle University Business School in the United Kingdom. Dr. Ahmed's research interests are based around digital business and social network analysis. Welcome, Dr. Ahmed.
Hi, thanks for having me.
Dr. Ahmed, could you tell us a little bit more about yourself and what got you interested in the work that you're doing?
Hi, yeah, sure. So as mentioned, I'm currently a lecturer in digital business at Newcastle University Business School. And before joining Newcastle University, I actually did a PhD at the Information School at the University of Sheffield, where I did an analysis of tweets related to infectious disease outbreaks. So I looked at the Ebola disease, swine flu, and the Zika virus. And that's where I kind of developed my interest in social network analysis and analyzing health-related topics. So when the COVID-19 pandemic was unfolding, it was generating a lot of data. And because I'd picked up a lot of these skills during my PhD, I then started to kind of analyze this data, kind of get insights into it and see who the kind of key people were around misinformation networks specifically.
Very interesting. So since the beginning of December 2019, the coronavirus disease, COVID-19, has spread rapidly around the world, which has led to increased discussion about across online platforms. These conversations have also included various conspiracy theories shared by social media users. Among them, a popular theory has linked 5G to the spread of COVID-19, leading to misinformation and even the burning of 5G towers in the United Kingdom. The understanding of the drivers of fake news and quick policies oriented to isolate and combat misinformation are key to combating it. And you described the objective of this study was to develop an understanding of the drivers of the 5G COVID-19 conspiracy theory and strategies to deal with such misinformation. Can you describe the key findings from this paper?
Yeah, sure. So there were a couple of key findings. So one of the findings was that a lot of people who were tweeting on this particular hashtag didn't actually believe the conspiracy theory. So the majority of content was either people downplaying the conspiracy or people who were sharing humorous posts and tweets and so forth. So the actual percentage was very low. Another key finding was around the network shape and structure. So firstly, there were a lot of people who were just tweeting about the hashtag rather than retweeting. So people had seen that it was trending and they wanted to offer an opinion and so forth. And we also found evidence of certain groups and clusters on Twitter that were trying to spread the conspiracy theory. So one account was set up and we labeled it a kind of activism account for the conspiracy. And the account would just tweet other users and tell them, have you heard about this conspiracy, and show them the hashtag. And that had quite an impact in kinds of generating activity for the hashtag. We also found the key information sources people were referring to. So alternative and fake news websites came up. We also found that some interested stakeholders might have been trying to profit from the conspiracy as well. So there was a website that claimed to sell protection against 5G radio waves, clothing, and other protective gear. And we found that people would actually use that as an information source as well. And they were active in the conversation, writing headlines and so forth. So some of the actors in these conspiracies might have financial motives behind them. Fake news websites might get income from advertising revenue through people kind of clicking on these conspiracies. And then based on these findings, we kind of developed some strategies as well for kind of public health agencies to deal with this type of misinformation.
That's all very interesting. Can you describe the methods that you used in the paper?
Yeah, sure. So we use social network analysis to analyze the data, drawing on Twitter's search application programming interface. So Twitter allows academics to connect to the platform, analyze the data, and so forth. So we use a social network analysis, which investigates how people are connected to each other and uncovers the key users in the network, or overall in the shape and structure of the network. We also supplemented the social network analysis with a manual qualitative analysis as well, to kind of find out whether people actually believed in the conspiracy. So we used a combination of those two methods.
That's very interesting. And what are the broad conclusions that we should take away?
Yep, so we had a number of conclusions. So we first, for the general public, one piece of advice was, if you do come across misinformation, rather than retweet or kind of amplify it, even if you quote retweet and then share some kind of humor around it, it could be easier just to report that content, because by engaging with it inadvertently, sometimes you might end up kind of spreading that further, and it might cascade in those ways as well. And other kind of conclusions and recommendations were to use fact-checking websites in terms of the general public. And for health authorities, we also, again, showed how easy it is to use methods like social network analysis to quickly obtain data from social media data sets, find out who the kind of key people are, the key narratives as well, to kind of inform health messaging as well.
Oh, very interesting. And you have some really great figures in the paper. So I'd love for you to just help our audience go through this very interesting figure, which is figure 1, the social network graph of 5G coronavirus. Could you walk me through this figure?
Yep, sure. So this is a network visualization that has taken everybody who was tweeting about this particular conspiracy theory, and it's put them in different groups based on how they were mentioning each other. If they didn't mention each other, so if an account just tweets without mentioning another account, they were clustered in the top left-hand group called the isolates group. Everybody else has actually tweeted to another person. If a group of users mention each other frequently, relationships exist between them that are stronger. And using a clustering algorithm, they're put in their own group. So you can imagine if you take the analogy of a kind of social gathering at a conference, you might see people cluster in the conference hall in different groups based on how they're speaking to each other. In this network visualization, we've done the same thing, but with Twitter accounts. So when we think about Twitter users talking about this conspiracy, we can actually see which users were speaking to each other. And this kind of forms groups and clusters that we can see. So what this tells us is that there was one large group of people who were just tweeting without actually mentioning each other. And typically really popular kind of networks, brands, for instance, if you think about Apple or other organizations, we get a lot of people kind of tweeting about them without mentioning each other. It also tells us which groups were making the most noise on Twitter, and how big those clusters were and who some of those key users were. So we could see that the largest group was a broadcast group. So that means there was a lot of users who were amplifying this message, just kind of retweeting it. They might have been following each other already, or had an interest in this conspiracy, meaning that they were kind of amplifying it. So this is the largest group in the network. So from a public health perspective, if we know what the largest group is and the type of messages they're sending and the key users, it kind of gives us an insight into what they were sharing and how to kind of disrupt some of those networks. And earlier I mentioned that there was also an activism account that was just tweeting other people. In group 4, we can see the impact of that account. So we've labeled it activism account. That one account mentioned so many other users, they actually formed a cluster within the network. And they also generated other activity as well. So there's a lot of engagement happening. And the key message there was, imagine if that account was shut down correctly. So it was shut down, but it took Twitter a while to actually find the account and remove it. But by then we can see it's formed a group and it's had an active effect on the network. If you remove that, maybe the conspiracy wouldn't have got as large.
Fantastic paper. What are next steps for your research?
Great. So what we've been trying to do in our future research is combine different misinformation networks. So we've looked at individual conspiracy theories such as 5G and COVID-19. But we're also interested in looking at commonalities between different conspiracy networks. So we've also published some work looking at the Fermi Hospital conspiracy, as well as a few others. And we're trying to kind of combine these different sources and also come up with more strategies for public health authorities to develop more kind of guidance for the general public, as well as the kind of citizens, even for instance, targeting younger people. So in schools as well, what can we teach younger generations about spotting misinformation and so forth?
What's the best way to keep up to speed with what you're doing?
Yep. So I'm on Twitter. So you can find me on Twitter. I'm on LinkedIn as well. So you could reach out there. I've got my own website as well. If you type in Google Wasim Ahmed, it should come up. There's a blog with lots of different kind of list of publications and so forth.
For more great articles like Dr. Wasim's, go to jmirpublications.com.